Research shows that when women are empowered as political leaders, countries often experience higher standards of living with positive developments in education, infrastructure, and health care. Remember our proud history of social justice, universal health care, public pensions, and making sure no one is left behind. Let's continue to move forward. Everyone should have health insurance. I say everyone should have health care. I'm not selling insurance. If we don't figure out a way to create equity, real equity, of opportunity and access to good schools, housing, health care, and decent paying jobs, we're not going to survive as a productive and healthy society. Universal coverage, not medical technology, is the foundation of any caring healthcare system. We went through substantial periods of being dependent on some type of government service, whether food stamps, WIC, Medicaid, children's health insurance. And I had an acute awareness as a child of what happens when people go without access to health care. I also had an acute awareness that people's lives were not valued the same. Security is still the most important issue facing Washington state residents and millions of Americans, the security of having a job, of access to affordable health care, of a quality education, and of protecting our homeland and defending our nation. We've had town hall meetings, we've witnessed election after election, in which the American people have taken a position on the president's health care bill. And the bottom line is the people don't like this bill. They don't want it. America's healthcare system is in crisis precisely because we systematically neglect wellness and prevention. Every single one of us deserves access to quality, affordable health care. Reducing healthcare costs for families requires increased competition in health insurance. Healthcare is a design problem. Dependence on foreign oil is a design problem. To some extent, poverty is a design problem. We need design thinkers to solve those problems, and most people who are in positions of political power are not design thinkers, to put it mildly. My contention is that if we expand the patient-centered healthcare approach, we'll have less people that have to go to the medical clinic that provides free service or go to the emergency room. They can have their own healthcare plan. Paul Farmer has helped to build an amazing healthcare system in one of the poorest areas of Haiti. He founded Partners in Health, which serves the destitute and the sick in many parts of the world, from Haiti to Boston and from Russia to Peru. It's part of the American experience. We deal with mosquitoes in August, airport delays around Thanksgiving, expensive health care, and the potential of being shot, at any time, by a semi-automatic weapon as we try to go about the most boring, precious, asinine aspects of our daily lives. Illegal immigration is not just a matter of interest in states along our border with Mexico. It is having an effect on local economies, schools, healthcare delivery, and public safety all across the country. My mother-in-law, Nanny, spent her working years as a bookkeeper at a medical office in Columbus, Ohio. Like so many Americans, she worked hard and paid into Medicare, knowing that one day she could count on having high-quality health care when she needed it most. In order to lead a country or a company, you've got to get everybody on the same page, and you've got to be able to have a vision of where you're going. America can't have a vision of health care for everybody, green economy, regulations, can't have a bunch of piecemeal activities. It's got to have a vision. A girl child who is even a little bit educated is more conscious of family planning, health care, and, in turn, her children's own education. In my home state of Indiana, we prove every day that you can build a growing economy on balanced budgets, low taxes, even while making record investments in education and roads and health care. Being a caregiver requires infinite patience, physical and emotional strength, healthcare navigation skills, and a sense of humor, which can be hard to come by after sleepless nights and demanding days. I believe in taxation and healthcare that is outside the usual libertarian mandate, because I don't want people to have to suffer. It's as simple as that. The healthcare system is really designed to reward you for being unhealthy. If you are a healthy person and work hard to be healthy, there are no benefits. Vaccines are the most cost-effective healthcare interventions there are. $1 spent on a childhood vaccination not only helps save a life, but greatly reduces spending on future healthcare. A retired teacher paid $62,000 towards her pension and nothing, yes nothing, for full family medical, dental and vision coverage over her entire career. What will we pay her? $1.4 million in pension benefits and another $215,000 in healthcare benefit premiums over her lifetime. I have seen that technology has contributed to improved communication, that it's contributed to better health care, that it's contributed to better food supplies, that it has contributed to all the basic human needs. Besides taking jobs from American workers, illegal immigration creates huge economic burdens on our healthcare system, our education system, our criminal justice system, our environment, our infrastructure and our public safety. So if people have an opportunity for a decent job, a decent education, a decent healthcare system and security, I know that forceful migration will be reduced to zero. The Democratic position seems to be everything is going to be free. Free education, free healthcare, free housing, free love, free kittens, I don't know. You can't afford to get sick, and you can't depend on the present healthcare system to keep you well. It's up to you to protect and maintain your body's innate capacity for health and healing by making the right choices in how you live. Access to basic quality healthcare is one of the most important domestic issues facing our nation. There's a big difference between France and the US. In the US, immigrants must work to live. In France, they're taken care of by public finances. In France, there are millions of unemployed people already. We cannot house them, give them healthcare, education, finance people who keep coming and coming. We have by far the most expensive health system in the world. We spend 50% more per person than the next most costly nation. Americans spend more on healthcare than housing or food. Illegal immigration costs taxpayers $45 billion a year in healthcare, education, and incarceration expenses. I have profoundly mixed feelings about the Affordable Care Act. What I love about it is its impulse. It attempts to deal with this intractable problem in American healthcare life, which is that a significant portion of the population does not have access to quality medical care. I think healthcare is more about love than about most other things. If there isn't at the core of this two human beings who have agreed to be in a relationship where one is trying to help relieve the suffering of another, which is love, you can't get to the right answer here. America's healthcare system is neither healthy, caring, nor a system. Patient autonomy is paramount to the oath that we take when we enter the profession of medicine. That is why I am appalled when the federal government gets between my patients and their right to the full range of medical information and complete access to health care. It's going to take each of us coming together to muster the strength to look in the mirror and ask, how can I help create a sustainable healthcare system for the 21st century? Poverty is multidimensional. It extends beyond money incomes to education, healthcare, political participation and advancement of one's own culture and social organization. Well, we lost a lot of our independence already. We are dependent on China for credit. We are dependent on Middle Eastern countries for energy supplies. And many Americans are dependent on the government for their income, health care, education of their children, food stamps. If you think health care is expensive now, just wait till it's free. Health care is not a privilege. It's a right. It's a right as fundamental as civil rights. It's a right as fundamental as giving every child a chance to get a public education. America's doctors, nurses and medical researchers are the best in the world, but our healthcare system is broken. America has the best doctors, the best nurses, the best hospitals, the best medical technology, the best medical breakthrough medicines in the world. There is absolutely no reason we should not have in this country the best healthcare in the world. If you want quality service, you have to pay for it. You don't buy into waste. I have great misgivings about the amount of advertising that we see in the healthcare field, some by hospitals, a lot by drug companies. Here in Silicon Valley, I have taken part in hundreds of conversations trying to convince people to dive in and become entrepreneurs. All too often, innovators with good, safe, jobs are unwilling to put their families' access to healthcare at risk by walking away from company-backed medical insurance. Today there are people trying to take away rights that our mothers, grandmothers and great-grandmothers fought for: our right to vote, our right to choose, affordable quality education, equal pay, access to health care. We the people can't let that happen. Strong advocacy for education, health care and worker safety will be indispensable if they are to get their fair share of President Bush's austere budget for the next fiscal year. Our healthcare system is the finest in the world, but we still have too many uninsured Americans, too high prices for prescription drugs, and too many frivolous lawsuits driving our physicians out of state or out of business. Visit our website for more quotes, quoting.com.